Hello, I'm Dr. Tombly, and this video is to give you a bird's eye view of how treatment is approached. We use three key pillars in developing anyone's individual treatment. One is the Gorski relapse prevention model. The second pillar is each person developing their own personal recovery plan. And then the third thing is addressing habits and developing willpower. Now, the Gorski model was developed by Terence Gorski in the 1980s. He was a psychologist and he was working in a hospital unit where chronic relapsing alcoholics had been uh, placed for treatment. And he worked with them over and over and over again, trying to find a way to address their chronic relapse and develop the relapse prevention plan out of that. It's been studied throughout the decades. It has been embraced by SAMHSA and ASAM as evidence-based practices. And the model integrates a bunch of state-of-the-art cognitive, affective, behavioral, and social therapies and actually takes them and organizes them in such a way that some of their limitations are overcome. The key to his theory is developing early awareness and early action of internal patterns allows even a relapse-prone person to be able to maintain sobriety and recovery. There are a couple of key definitions and phrases that are thrown around a lot in treatment, but I think they're very meaningful and it will help us create the context. First is a definition. What is addiction? We use the American Society of Addiction Medicine, ASAM's definition, that addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. So any good treatment is going to address all of those areas. The way we say it in a more simple fashion is that your brain has been hooked, hijacked, and hacked. So this understanding of what addiction is leads to our understanding of what recovery would look like. And there are three key phrases that we say regarding recovery. First of all, abstinence is only the beginning of recovery. Recovery goes way beyond just stopping the use of a substance. Number two, that recovery is actually living a healthy and fulfilling life without negative behaviors. In fact, this is the goal of all healthy human beings. And third is that recovery is putting your disease into remission and keeping it there. Understanding that addiction is a chronic medical disease, we put it in remission. And we've had some recent research that helps us even understand that a little bit more. I'll talk about it briefly when we get to habit formation. Gorski proposes 6 stages of recovery. The first being transition. That's when a client recognizes that they have an addiction. This stage has an unlimited amount of time based on them finally coming to that awareness and that acceptance. Number 2 is the stabilization phase. This involves usually detoxification and some level of recuperation, stabilization for crises that were developed during the use of substance. Stabilization is what we do in residential treatment primarily or during the first 2 months of outpatient treatment. The third phase is early recovery that starts from once a person is stabilized and goes up to 12 to 15 months. Here they're focusing on changing addictive thoughts, addictive behaviors, and addictive feelings. Then after they hit that 15-month mark, they're generally moving into middle recovery. And this is where they're balancing lifestyle. They usually have reduced the number of hours that they're in formalized treatment, and they're living a fuller life during this period of time. Middle recovery goes from about 15 months of sobriety to about 3 years. And at that point, they enter late recovery. Late recovery goes from 3 years to 5 years, and then maintenance from 5 years and beyond. So again, those three pillars, the relapse prevention model, and it involves 5 rules and 11 phases. Let's take a look at that more closely. What are the 5 rules? The 5 rules are be completely honest, ask for help, use good self-care, change your life, and don't bend the rules. The first couple of months and that early recovery, that's what they're learning to do, just to actually live by those 5 rules. And then to begin to practice the 11 phases of relapse. So Gorski, you remember, was focusing on the idea that people could, with awareness and actions to the process of relapse, could prevent relapse, thus put their disease into remission. So he has 11 phases. You can see them there on the left of the slide. And notice number 10. Number 10 is the actual physical reuse of a substance. So they learn that there are 9 things that take place before they ever reuse. Now, unfortunately, in someone in heavy addiction, they go from stage 1 or phase 1 of relapse to phase 10 sometimes in a minute and a half. So we're learning to slow down the process during early recovery, those 12 to 15 months. And they will learn what each of these phases are, what they do when they're in that phase, and they'll develop an exit strategy when they discover they're in that phase. When you've heard the phrase relapse is a part of recovery, this is what we really mean. That everyone is going through a relapse cycle long before they reuse. They just need to be able to become aware of where they are and how they can exit. Let me give you a simple example of a compulsive behavior. Maybe it's getting into a fight with your spouse, or maybe it's eating after 10 o'clock. Just little compulsive behaviors that may not be directly related to substance use. However, they're part of trying to stay in a denial pattern and avoid the unhealthy emotions that they need to resolve. The second pillar is developing new trigger habits. The work of David Duhigg is been very influential here. We understand that habits are actually recorded in the basal ganglia of the brain, and it appears that they cannot be erased, that they stay intact. However, we are able to modify some of those habits and even develop stronger habits. So we can weaken a habit that's stored in the basal ganglia. But when we introduce a new habit and have it firmly formed, then that habit is also encoded forever in the basal ganglia. And so we encourage clients to develop simple, easy, repeatable habits that they can do every single day that trigger them toward the positive recovery lifestyle. Okay, now these habits have to have a sense of accomplishment. They usually are developed within a sense of community, but once they are there, they are easily doable and are constantly moving toward recovery lifestyle rather than a substance use lifestyle. We also talk heavily in this section about willpower. Willpower not being something that necessarily is developed over time, but that willpower has to do with the capacity at the moment. So instead of thinking about willpower as a muscle, you could think about it as a gas tank. And are we being responsible to make sure that we have enough willpower stored up? And so part of the 5 rules and part of the habits are about making sure that there's enough willpower stored up within us so that we can encounter and overcome the issues that we may face. Lastly, we have the personal recovery plan, and it's one of the most important pieces. This plan is 3 to 5 things that are based on the stage the client is in of recovery, and it's developed using some trial and error, so there's some adjustment to it, and it's very individualized, focused on what their strengths are and on making sure it addresses their weaknesses. Here's an example of a fictitious client's plan in early recovery. I threw up their 3 trigger habits just so you could see an example of those. Making the bed, reading a paragraph of literature, and praying the serenity prayer. 3 things they can do within a minute and a half or less, and it tells them, I am in recovery, I need to keep doing my personal recovery plan. This person's recovery plan consists of 5 things. Number 1, complete treatment court. That means attend all their treatment court meetings and their treatment meetings. Number 2, take their medication every day. Number 3, attend NA twice a week. Number 4, spend 2 hours a week doing a sober hobby that doesn't have any old friends attached to it, and to maintain their employment. 5 things that are going to carry them through that early recovery phase. Once they get to the end, then they would readjust these. All right, look forward to our next video.